Welcome to Focus on Albany. I'm Cynthia Poole. My guest today is Dr. Dorsey Applyrs, the city auditor. And Dr. Applyrs is going to talk about her premature baby. So, I read about it in the paper and then I thought, oh God, I'd love to interview you on that. So your baby was born after 23 weeks, right?
Yeah, so my water broke at 23 weeks and she was born 24 weeks, 2 days.
Oh, so that must have been quite the ordeal.
It was very scary. In hindsight, I would say it was one of my darkest, and I've had some tough times in my life, but that was one of the most challenging, darkest moments for me and the family.
So your firstborn, was she full term?
Yes.
So so your second baby, that had to be quite the shock when when your water broke. Um, so tell us the circumstances in which that happened.
Well, it's interesting because with my first daughter, it was a easy planned C-section. And so for those who are familiar with the C-section process, I went in knowing that we would have a planned C-section for delivery with my first daughter. So when my water broke, I was actually at City Hall.
Oh boy.
I did not even know that my water broke because because of the nature of my first pregnancy and delivery, I didn't know what it meant for my water to break. I didn't know what to expect in terms of a feeling. So I thought, oh wow, this is interesting. I think, the baby's pushing on my bladder and maybe I kind of just went to the bathroom with myself. So I really
Ooh.
did not even know that my water broke. Um,
Uh,
that was a Friday, and so I went into Saturday, and the same thing happened. And that is what triggered me to call my doctor because it just seemed to know your body, something seemed a little off.
right. Were you getting contractions at that point?
No, I was I was scheduled to be traveling to Vermont. And so I wasn't in pain. But something, that inner voice, something kept saying, call the doctor. I was actually planning to continue my plans to go on the trip, but it was that inner voice that said, call your doctor. And that's what started the whole thing.
So after you called your doctor, what did your doctor tell you to do?
Very calm. She said, you can go to Bellevue Hospital or you can go to Albany Med. Um, so she gave me the option. She said, I'm not sure. We don't know what's happening, but we just want to double check. So you can go to Bellevue or Albany Med. And she said, once I get a report, we'll decide what the next steps are. And that's how she left it.
So then you continued to be in a compromised position, physically. What happened after you spoke to the doctor?
So I decided to drive to Bellevue, and keeping in mind that we were in the middle of the pandemic. From my experiences, I knew that Albany Med, there were, from my experiences visiting friends and loved ones, that the wait time was long, and so I said, let me drive out to Bellevue, and this should be a quick trip. My husband was out of town. He had just
Oh, wow, you drove yourself?
I drove. Again, I'm not thinking anything's a major problem. And so I drive out to Bellevue, and I tell my dear friend who was watching my daughter, I'll be back in time for dinner. And I get to Bellevue, They see me right away, and the doctor performs the exam, and she says, "You have dilated."
Oh, wow.
And I was in shock. I
Uh-huh.
I couldn't fully comprehend what she was saying. She said, "You are experiencing preterm labor. Um, so what happened to you is that your water broke. You have started to dilate, and we need to rush you to Albany Medical Center." And,
And
and
at that point, you still didn't feel any contractions?
at that point, no contractions. Um, at that point, I just burst into tears. I
Wow.
immediately thought that I was losing the baby. I was scared. I mean, to go from thinking, oh, this is just some routine check, to all of a sudden the doctor saying, we don't know when this baby is coming, but your body is showing signs that this baby is on the way. And again, I'm so early, I immediately assumed that I was losing the baby. Um, and so I had to start making some tough decisions really quickly.
And what are those decisions?
So one of the decisions I was struggling with the conversation with my husband. He had just landed in Las Vegas. He was there for his birthday celebration with his dear friends, and I was wondering, do I call him? He's not 20 minutes away. He is in Las Vegas.
Wow.
So I'm one. Who should I call? Should I call him? Who's going to come be at the bedside? Is the baby coming right now?
Right.
Will the baby survive? And so immediately, while I am crying, I am trying to process what's happening, and who do I need to call as I am preparing to be rushed to Albany Medical Center.
Wow. So you had to make all the decisions by yourself.
In the moment, yes.
Oh boy.
Yeah.
And you were in labor besides.
I with the doc, things started to move rather quickly. Uh, they were coming in to try to educate me as much as possible. One, because I was 23 weeks, the baby's lungs were not fully developed.
Mm-hmm.
And they made it very clear that if the baby came without the lungs being developed, the baby would not make it. And so they immediately asked my consent to start a medication that would help with expediting the baby lung development. And so there are, of course, side effects to the medication. Um, the medication made me bear, it caused some level of discomfort. It caused me to be a little out of it. But I consented, and they immediately started this medication to try to expedite the lung development, but also medication to try to stop, to prevent my body from starting contractions and going into full term labor. So they started that promptly. And then at that juncture, we were waiting for the paramedics to arrive to transport me to Albany Medical Center.
So when you were at Albany Medical Center, how soon after that did you give birth?
I was there probably about 4 days. I'm sorry, 3 days before giving birth.
Uh-huh.
Maybe 2 to 3 days. It's a blur, but maybe 2 to 3 days. I'll never forget. I get rushed to Albany Med, and my first night there, and my husband is on a red eye back to Albany, and I had a young lady in my room, and when I got into the room, it was late, so I never saw her. I only heard her, and she had been there for weeks. And that morning, she walked by my bed to go to the bathroom, and I said, "Good morning." She said, "Good morning." She was visibly pregnant, and she calmly walked back to her bed. Within 2 minutes, a slew of doctors, nurses come rushing in. They immediately started to gather her and her things. One doctor was on the bed with her, holding. So what happened was she went to the bathroom and realized that she was in the process of giving birth. And so one doctor was literally on the bed, holding the baby's head in place so that
Oh,
they
wow.
rush her to the OR. And I just started crying. I remember I was so traumatized because I'm there with the hope, because the doctors kept saying, and the nurses, keep this baby in as long as you can. Keep this baby in as long as you can. Every day matters. The longer she stays in there, the likelihood you increase her survival. And so this is my first experience in the hospital, and my roommate is being rushed to the OR because she went into labor, and the baby didn't make it. I heard that the baby didn't make it, so I was devastated, and I was already scared, but that really was traumatizing, and I wasn't sure what to do. I was just, I didn't know what to do.
Was that baby premature also?
Yes, for all of the women on the floor, we were there because of in various ways. We were experiencing preterm labor, and she had been there for, it was my understanding, she had been there for about 4 weeks. And so the baby did not make it. She never came back to the room. Of course, she would not have come back, but I never saw her again. I never saw her again.
That's too bad. So, you were the you were still pregnant, and they tried to keep the pregnancy as long as possible. How did they do that?
One, I was off my feet. They were trying to keep me from being stressed. And it was really, it was the medication. Um, it was a waiting game.
Mhm.
That's really, my body was in control. Regardless of the medicine, regardless of being off my feet, they made it clear that my body was going to do what it wanted to do. And that that really came to fruition when I actually started experiencing contractions. No, regardless of, again, the medication
Mhm.
and trying to de-stress, I started experiencing contractions.
And was your husband back by that time?
He had arrived.
Okay.
He was there. He was trying to help keep me from stressing and focused. And we both had the goal. We were going to try to keep the baby in as long as possible. And keep in mind, we didn't know, I was at probably about 5.5 months. We didn't know if we were going to be there for 1 week, 1 month, 2 months,
Mhm.
3 months. We didn't know anything. We were just taking it moment by moment.
Mhm. So, since your first child was a C-section, did they take your second little girl by C-section too?
They did. They kept saying to me, "We want to prevent you from having an emergency C-section. We want this to be planned, but you have to consent. You have to tell us when it's okay to take the baby. Um, if we have an emergency C-section, anything can happen, hence increasing the risk that the baby might not make it." And
Mhm.
so I'm conflicted because on one end, I'm hearing, keep the baby in as long as you can. Keep every day counts. Also,
Right,
that the baby's lungs were not fully developed. They were
right.
giving me the statistics on the percentage of babies that make it versus the babies that don't. And I because I had a planned C-section with my first child, I didn't even know what a contraction was. So I was feeling something and I was trying to explain to the nurse what I was experiencing. And she said, "Do you think it's a contraction?" I said, I don't know. I've never had a contraction. And so for about 24 hours, I was actually in labor. I started my body, the contraction started to intensify. And I was holding on for dear life despite being in so much pain. I just kept hearing, "Keep the baby in as long as you can, keep the baby in." And it got so bad that I physically could not endure the pain. And my husband and I had to have a conversation about consenting to the C-section. And the doctors came in, they briefed us on everything, and my husband said, "Can you give my wife and I a moment?" And I was in tears because I knew that as long as that baby was in my belly, I could hear her heartbeat. The entire time that I was in the hospital, they had me hooked up to a heart monitor so they could hear and I could hear the baby's heart beating.
Wow.
And so that is the hope that kept me going, is because I could hear that heartbeat.
Mhm, mhm,
And I knew that once we scheduled that C-section, I didn't know what was on the other end of that.
right.
And so I was scared, I was stressed. It was the toughest decision I've ever had to make.
Mhm.
I'm a woman of faith, so I was praying, I was talking to God, I'm crying. And my husband said, "I don't want to lose you. You are physically uncomfortable. We don't know what's happening with your body." And one of the doctors said, "You may have an infection, and hence your body may be trying to get the baby out. So while you think you are helping the baby by keeping her in, your body in its infinite wisdom is possibly trying to get her out." And so that's what started the process of the C-section happening.
Now you said you had given birth at 23 weeks, right?
24 weeks, 2 days.
Okay, my friend Russell's niece lost her child at 21 weeks.
Mhm.
And I keep telling him, if she had only held on for a couple more weeks. And it's difficult to explain to a man what
Yeah,
it feels like,
yeah,
and it's tough.
yeah, yeah.
So after you had given birth, what happened?
Well, I have to be honest to say, I checked out once I gave them consent. Um, I've never experienced this. I literally went inside myself. I numbed myself. I knew that there was a chance that once the procedure happened, that I was no longer going to hear the heartbeat, that the baby wasn't going to make it. And I just checked out mentally, emotionally. Um, I don't like needles, and it got so bad that I had checked out even physically. They were poking me and trying to put IV in, and it got to the point I was just so checked out. My husband looked at me. I remember they were wheeling me out of the room, and the way he looked at me, he didn't say. We prayed, and then they were taking me out, and he just the way he looked at me, I've never seen him look like that. And I was so out of it that I could not respond. I couldn't console him because I really could not even console myself.
Right,
He looked very concerned. He looked worried for me. He kept saying, "As much as we want this child, I want you to come home. I need you to make it.
right,
God forbid, even if the child doesn't make it, I need you to make it." Um, and so I was just out of my I had an out of body experience. I was just completely checked out. Um, and so I'm on the table. It's a sterile for anyone who's been in the operating room to give birth. It's a very sterile environment. It's cold. They're poking me, and I'm on the table, and I'm just again, I am. checked out, and then I hear the baby. I didn't hear them cry, but I heard them say she's coming out. Um, and I, unlike my first pregnancy, where when the baby, my daughter came, they laid her on my chest.
Right.
They said the baby's out, and that was it. I didn't hear a cry. Um, I was just scared. I was I was waiting. Um, it took a while, and then my husband checked in with me, and I said, "Did she make it?" I looked at him and I said, "Did she make it?" And he said, "She made it." And it was at that time and only at that time, I gave myself permission to close my eyes and get some rest. I was physically, emotionally, spiritually exhausted. I had been, even though I was checked out, I was praying. My deceased mother, I was talking to my mom. I just, it was a very interesting time in my life, but once she made it, uh, I just gave myself permission to get some rest and go to sleep, and that was that.
So did you, with your second child, your premature child, was she C-section or was it a natural birth?
It was a C-section.
Okay. Okay. So then the ordeal came in where they probably put her on all kinds of machines and stuff, right?
Yes, I had not seen her. My husband was the one who was able to see her. So again, I know she's here, but I cannot touch her. I cannot see her. I don't know what state she's in. I just know she's here. I don't hear her cry. And my husband went with her to the NICU immediately, and they took me to the room. My husband brought a picture, and she was immediately, when she came, the doctors and the NICU team at Albany met, amazing. They immediately went into action mode and was hooking her up just to make sure that she was warm and she was hooked up to the correct machine. So
Right.
she immediately, they had to make sure that now that she made it out of my body, that they could keep her alive.
So how long was she in the hospital after you gave birth?
We were in the NICU for 3.5 months. She
Wow.
was born 1 pound, 9 ounces.
Hmm.
I could not, I saw her the next day. They wheeled me down in a wheelchair to the NICU, and I couldn't hold her. My
Hmm.
first encounter with her was sticking my hand through the little, some call it a little incubator,
Hmm.
and I was able to touch her foot. That was our first mother-daughter
Wow.
interaction, with me being able to touch her foot. She was hooked up to all types of machines, blue lights. I could barely see her face.
Hmm.
Um, so that started another journey. So we went from the unknown with the pregnancy
Right.
to now the unknown with is she going to make it out of this NICU? So we were in there for 3.5 months.
Wow. So during that time, what kind of treatment did she get?
She she had to have heart surgery.
What?
She had what they call a PDA. She had a hole in her heart that would not close through regular medication. So again, another curveball. We were told that she
Oh
was
my
going to have
God.
to have heart surgery. I was a wreck. Her little body, not even 2 pounds.
Hmm.
And maybe at that juncture she was 2 pounds, but she was so tiny. She also had to have injections in her eyes because that she started to develop abnormal blood vessels in her eyes, behind her eyes. So she had to have heart surgery, eye injections. She had to go on steroids. I mean, it was such an emotional roller coaster. And the NICU nurses told me it was going to be up and down days. Every day was going to be different. And that's essentially what it was. It was so unpredictable. Every day was different, and we were on pins and needles the entire time.
Now, how old was she the first time you were able to hold her?
So interestingly, I would say day two, I was in her room, and the the doctors and nurses came in, and they were briefing each other on her progress and what was happening. And the male doctor, it was a male, he said, "Mom, have you held your baby yet?" And I said, "No." He said, "Everybody out. This mother needs to hold her baby. The next,
Uh-huh.
we can have these conversations another time. Let's let mom hold her baby." And
Mhm.
that was the first time I was able to touch her and hold her on my chest.
But, she was a little over a pound. You had to be pretty stressed and worried that you were gonna hold her properly, right?
I wasn't, and it took a team just to get her out of the bed. It took a team to get her on me. She had so many wires hooked up to
Oh
her
my God.
from head to toe. Um, they had to wrap her in plastic wrap because she needed to stay warm. So she was wrapped on my body in plastic wrap. She needed, of course, her hat on. They were trying to make sure she stayed warm. So I was holding her. I was nervous. Um, and I couldn't move once they said, make sure you go to the bathroom, make sure you eat, because once she's on you, it can distress her to properly move her and to constantly move her.
Mhm.
So ideally, and this went on the entire time in the NICU, once she was on me, I had to be stationary for at least 45 minutes to an hour, because I could not, the purpose was to keep her on me for at least an hour,
Mhm.
not to distress her. And so it was tough. It was tough.
You know, back in 1963, a few months before the president was killed, Jackie had a I'm so sorry about
It's okay.
Jackie had a baby boy, and the baby was 7 months. And at that time in 63, they didn't do as much as they do right now. And she had given birth after 7 months, and the baby died after a couple of days at 7 months. And the worst part, she never held her baby.
It it's unimaginable. Um, I'm able to sit here and have a conversation with you today. My life, my life looked completely different this time last year. I was a wreck. I was,
Right.
I was a wreck. I was constantly in tears. Um, I had to, I think one of the most painful things was I had to still go shop for the baby. So I had to go to Buy Buy Baby and other places to get things. And every day they would say, tomorrow's not guaranteed. So while some parents were there with their little baby and they were shopping and buying things, I had this voice in the back of my head constantly reminding me that I my baby could be gone tomorrow.
Uh-huh.
Um, it was I have a different appreciation for mothers who go through the NICU, mothers who lose their children, because it is such a sensitive experience. It's such an emotional journey. Nobody knows what you're going through.
Mhm.
Nobody
So, any woman at any age can experience something like that.
at any age, at
Mhm.
any age.
So, what's the statistics of how often this happens?
That I do not know.
Okay.
they could not even tell me what caused this. Um, they later, once I delivered the baby, they did say that there was an infection brewing, and so it was best that the baby came out. So again, our bodies and their infinite wisdom, my body was saying something's going on in here, and we need to get her out of here.
But you know, we have a horrible drug problem in this country. And there are many women who are pregnant, who are addicted to drugs. But I've never heard of any addicted mother giving birth to a baby that premature.
Well, it happens. Drug use can increase your risk of premature delivery. Uh, Stress can having an infection, an unknown infection can. So there are a number of factors that can contribute, and sometimes it just happens.
Mhm.
None of us know. In this case, maybe it was the infection. I'll never know what exactly caused me to go into
Right,
labor.
right. So, um, what words of advice would you have for young mothers who might be experiencing the same problems that you had?
First words of advice would be listen to your body. Had I not called the doctor, this could have been a very different outcome. It was the doctor that said, go to the hospital to get checked out. Um, so number one, be in tune. And if you even feel that something slightly could be wrong, call your doctor. Don't wait.
Mm-hmm.
My prompt action is what saved my baby's life, I'm sure. The other is, you need somebody. In this case, I had my husband, but before my husband came, my pastor and a nurse from my church came.
Uh-huh.
You need an advocate in the hospital.
Mm-hmm.
So while I was able to do some level of advocacy for myself, it is an overwhelming experience, and you need someone at the bedside who can navigate the healthcare system and the people. So identify who those people are. The other thing I'll say is give yourself some grace. I started immediately blaming myself. Well, what did I do wrong? Why? What did I do? And so we have to give ourselves grace because no one can, I don't know what caused this. And so it was hard. The journey was hard enough. So why add to it by beating myself up about it?
Right.
So we have, as women, we have to we have mom guilt. And we feel like if we had just done something differently, maybe there would have been a different outcome. So I would say, give yourself some grace.
Wow. Powerful story. Um, you've been listening to Dr. Dorsey Applyrs. I'm Cynthia Pooler. This is Focus on Albany. And if you like this show, please subscribe to my YouTube channel. Dorsey, have a great Thanksgiving. Thank you.
Thank you. Thank you so much.